This is a container system that we use for packaging our instruments. We use this to package instruments and sterilize them for surgical procedures. Over here, there is a count sheet that we do not put into the tray that will be seen by the nurses and techs in the room to count for the instruments. This count sheet will indicate whether an instrument is missing or the amount of count that shows the accuracy of our instrument tray. We're going to open this tray, and I want you to pay a keen attention to the detailed setup of this instrument. This is a lumbar laminectomy that is used for spine procedures. Before this tray is opened up in the operating room, technicians will go ahead and check for locks and make sure the locks are intact. This is a thermal lock. If you look at this red spot over here, this is a thermal lock. Make sure both sides are locked on the tray before they are open. Now that I twisted this tray, it might be a little shaky. Just imagine this is in the operating room. We open up this tray for the technician. The first thing the technician look for will be the indicators. When we have indicators in the tray, for a tray this wide, we put indicator on opposite adjacent corners. So over here will be one internal indicator. On this corner will be one indicator, because these four corners are the hardest to reach places for steam and right dead in the middle. We also look on this opposite adjacent end of the tray where we find our other indicator. There's a second set of indication that this tray was exposed to steam. Our indicator tells us whether it was accepted or rejected. If you look at it here, your instruments are arranged from bigger to smaller, and if you notice, they are all pointing in the same direction. I shook this tray up so it's kind of scrambled. We have all of our retractors over here. On the bottom of this tray is a tray liner. The tray liner is there to help the absorption during the drying of the sterilization process. If you notice, all of our instruments are crisscrossed and nested together. If you look at these forceps, they're all nested into one another so that they don't scrape anything else. This is what it looks like when you open up your instrument tray for a surgical procedure.